when I started graduate school, I wanted to get involved in a project that I could see the relevance of. And I did my graduate work at the University of Iowa, and there was a professor in the Department of Anatomy, Dr. James West, and I started working with him. And he was an expert in fetal alcohol syndrome and looking at the damaging effects of alcohol on brain development. And so it was really my interactions with him that brought me into the field. And so I've been in the field ever since. And so I think what's really exciting now is that we're seeing a lot of different approaches in terms of trying to treat children who've been exposed to alcohol prenatally and improve their outcome. But my focus really in the last 10 years has been on this nutritional intervention, and the nutrient is choline. And I got interested in choline because it's a nutrient that's important for brain development. And in fact, there's a literature in typically developing animals that showed that if you give choline during the prenatal period or early postnatal period, it has long-lasting effects on their cognitive functioning. So we thought, well, what would happen then if we used it in our model of alcohol-exposed animals? And in fact, we've been really pleased with seeing the results. We found that we can give this nutritional intervention either at the same time as alcohol, so during the prenatal period, or we can even give it after the alcohol exposure has occurred and still see some beneficial effects, particularly on cognitive tasks. And at this time, though, we are seeing some translation of this to clinical populations. So there are a couple of studies going on right now. Now, getting to some of those specific questions, well, how much and when do you have to give it and all of those, we're really not quite at that point. A lot of the clinical studies have kind of used the measurement of twice what the adequate levels are. But to address many of those questions, we really have to conduct these clinical trials. We've been looking at actually a variety of different outcomes, motor, cognitive, and depending on when we give the choline. If we give the choline during the prenatal period, we tend to see that there are some mitigative effects on a broader range of outcomes. If we give it during the postnatal period, it seems that it's having more effect on brain areas that are important for learning and cognition. So the hippocampus, for example, or the prefrontal cortex, which is involved in executive functioning. Now, attention is a part of that, but our behavioral measures have focused kind of on response inhibition and behavioral flexibility. And there's concern that even light drinking may be damaging to the fetus. In fact, some of the basic science research would suggest that that is the case. So really, we've taken kind of the public message that the only safe level is no alcohol. And so we really don't know what some of the consequences might be of that light drinking. What I'm seeing is really an explosion in terms of behavioral or environmental interventions that I think can be very safe and probably very effective. They're not necessarily the easiest to implement, but I think that those really show a lot of promise. And hopefully in the future we'll get to a point where we can see different combinations of these behavioral, nutritional, and perhaps even pharmacological interventions that together could give us the best outcome.